Hey, everybody. Welcome to Resiliency Radio, your go-to podcast for the most cutting-edge insights in integrative and functional medicine. I'm your host, Dr. Jill, and with each episode, we dive into the heart of healing and personal transformation. Join me as I interview medical experts, world leaders, and biohackers of all types to help you optimize your performance and longevity. Today, you are going to love this episode with Dr. K. What if the hidden root of your child's anxiety, behavioral disorders, learning struggles wasn't psychological, but biological? Today's guest reveals how the gut microbiome, fungal dysbiosis, mast cell disorders can contribute to your child's mood disorders, behavioral issues, or other learning disabilities. And I know you're not going to want to miss this episode with Dr. K. I will introduce him in just a moment. But before I do, I just want to remind you, number one, if you haven't yet subscribed, I hope you'll join the over 600,000 subscribers that we currently have. Just click that subscribe button and click the bell to be notified of future episodes. Also, if you haven't been around or heard, I have a slew of wonderful products for your health, for your beauty, for your optimization of performance. You can find them all at drjillhealth.com. It's drjillhealth.com, and you can sign up for our newsletter and discounts there. We have solutions for mast cell disorders, for gut dysbiosis, for gut healing, for food sensitivities, for Epstein-Barr, and anything you can imagine, even overall just immune function. One of our best sellers is Immune Essentials, and you can find that and more at drjillhealth.com. Be sure and check it out. Okay, without further ado, I want to introduce our guest today. Our guest, Dr. Pejman, Dr. K, he goes by, is a board-certified pediatrician who completed his undergraduate at UCLA and obtained his osteopathic medical degree at Western University. He completed a pediatric residency at Loma Linda University, where he stayed on as teaching facility for over 4 years. He also completed 2 fellowships in integrative medicine and has over a decade of clinical experience helping children with severe learning and behavioral challenges. You will love his demeanor, his wisdom, and his knowledge. And if you have a child in your life or know someone who does with difficult gut issues, you are going to want to stay tuned. This is one of my favorite episodes and one of my favorite interviews. So without further ado, let's join Dr. K. Dr. K, I'm so excited to have you back. We both swim in the same circles with the ICI and the ILADs and complex chronic conditions. And you have the clinic Holistic Kids and the website holistickids.com. I always really enjoy talking to you because so often the future of our, nation and everything relies on our kids. And I think more than ever before, we're seeing a lot of the complex chronic stuff we used to see only in adults in kids more than ever. And it's just a really important area. Before we dive into that, tell us just a little bit about you. How did you get into medicine and pediatrics? And then how did you get into dealing with some of the most complex cases in pediatrics?
I guess you could say, early on, as this little, budding student in college, I liked science. I liked helping people. So I thought, well, gosh, that medicine is a decent way to do both. When I started school, I actually came to dislike medicine so much. And I mean, as a medical student, you have no idea why you're feeling so resistant to it. But ultimately, I was actually thinking of going into business administration and leaving medicine altogether until I did my first pediatrics rotation. I had no clue at all that I liked kids in any way, shape, or form. But then when I interacted with the kids, there were like little ponies flying around, rainbows started
Yes.
popping up. And like my second day of pediatric rotation, I was sick as a dog. Like I had a 104 fever, was feeling
No.
like I was about to fall over, but like I was still in love with these little people. And God, 16, I guess, plus years, more, geez. Uh, Years later, 18 years later, I still adore these kids, and every interaction with them I have is, magical. Um, Functional medicine really, I'm sure with you, the more you look at medicine, the more we realize how many things it cannot answer, right? And the more you look at things and ask questions of like, well, why does this happen? Why does that happen? Why do these things come about? And everything's like, well, we don't know, but no one else has the answer either. And it's like, well, how is that possible, right? So for me, functional medicine, integrative medicine, all of these different modalities is really just opening the door and creating space for new information and treatments to show up. And I tell all of our families, for me, medicine is just medicine. Healing is just healing. It's a matter of, can you look at enough problems in enough different ways and find the best tools, whether it's pharmaceuticals or supplements or botanicals, with no bias to help. And, I kind of look at it as, I try to take on an engineer's mindset, right? Engineers have no attachment to what they do, right? Science is science. It's either something works or it doesn't. It's either you have a good explanation for why something is happening or you don't. And if anything, I try to disprove myself every 6 months or so and try to update my understanding and my approach as often as possible. And a lot of that really comes actually from my families. They show up with something. They're like, what do you think about this? I'm like, God, that's a freaking great idea. I hadn't thought about it. And, through them and obviously learning and reading, papers and attending conferences, the goal is always to push yourself, right? And what you thought you knew to try to disprove and come up with a better way of understanding things. So that to me is kind of where functional integrative medicine comes in.
Gosh, I love your description of that. First of all, the kids, because there is such a joy and purity. There's no filter, right? It's before we have the filter. And I think maybe that was part of your delight. Who knows? But in seeing these kids, because they just say what they want to say. And there's such a freedom and joy to see that expressed. Before they've been, the world has shut them down or whatever else has happened. And you get the bonus of dealing with the parents too, which often is an absolute joy, but
Yeah.
complicates things. So what a great area. And like I said, I think there's maybe no more important area of medicine than pediatrics because we're changing the future of our, society through the kids and through their health. And we also see these patterns that we're going to talk about today that manifest in the kids, and even talking, I did an interview recently with Ann Shippey about fertility and conception, and it starts with the parents and their lifestyle and their genetics and that thing. And then, of course, this passes down in generations. Today, our topic is autism, mold, and the microbiome, and that opens up a lot of doors for us to talk about. I really loved how you expressed the engineering mindset because I feel like the best clinicians are just open-minded and curious, and so often the ones that patients come and complain about are the ones that after medical school thought they learned everything they needed to know, and once they walked out those doors with a degree, they that's it, right? And the opposite, you and I are always like, oh, really? And just like you, I so often have a patient come in and share a new study or a new protocol or a new thing. I'm like, really? Tell me more. And then I dive into researching, and as long as it's safe, I think my job and your job is to assess the safety of some new thing. And so often, say IV vitamin C, well, there's a very low risk, right? And there's a potential benefit, and we may not have huge randomized controlled trials, but when the safety is likely there, it's likely fairly benign, and then the potential upside is really great. I'm always willing to try new things. And I hear that in you too.
Yeah, yeah, absolutely. And I think in a way, if I could rephrase what you're saying, we're, as we kind of look into the frontier of medicine, right? And we take really the science that's unfolding right now. And I think that that's the most beautiful part of this work, right? We take the science that is getting published and the papers are 2 to 3 years old, and we translate that into our medical model and into our practice. And with that, it's exactly what you said. Is it safe? Is it capable of causing harm? If there is any harm, how do you mitigate that harm? And ultimately, the patients will tell us the rest in terms of if it's helping or not and how much potential there is.
Amazing. And so
Mhm.
often we have these large randomized controlled trials, but who really is that N of one, right? Like it's also thinking of the patient. I've just continued to see it's way better when we think of them as an individual and use the science, just like you said, but also really be open to their own genetics. And I'm sure you, like I have had patients that are super sensitive to supplements. So I have to go really slow and I have to change my protocols. And we just have to be really flexible to deal with the complexity of the human that's in front of us. So I want to dive in. One of the most exciting things about me being here with you today, I mentioned right before we went on, and that's we're going to discuss mold and fungus and all of that and how it interplays, especially with your pediatric population. I feel like in my experience, I'll just give you a little backstory because I had Crohn's over 20 years ago. And one of the big ahas in me completely being cured and in remission from Crohn's, like zero symptoms, no sign for 20 years, was the fungal microbiome. I had an immunocompromised system after my cancer and I had severe fungal dysbiosis. No doctor was talking about it, no doctor was testing for it. And on my own, I discovered that. And through the use of herbal and other antifungals and treating that, I feel like that was probably 80% of my complete cure of Crohn's disease, right? Now,
Oh.
this makes sense, but do you want to describe what are you seeing in the pediatric populations as regard to not only yeast in the gut and the microbiome and mold, and maybe start to pull this together for us? Because I think a lot of our listeners are like, fungus. My doctor says that doesn't exist, right?
Mhm. Yeah, and I think like that is part of the problem, right? So many providers are of this mindset of everyone has a little candida, everyone has a little mold, everyone lives in a little mold. It's not a big deal, right? And that is the prevailing mindset, not just in the conventional medical community where they completely discount these possibilities, but I would say also in some of the integrative circles,
Yes.
right? Because they run stool tests, the stool test shows them a picture, and they run with that picture without realizing what else is getting missed. And one of the I think the big problems is that up until recently, and I don't know if you've seen some of the new kind of microbiome tests that have come out by Dr. Vojdani,
Yes.
that we haven't had good tools. And so Dr. Vojdani, who's one of my mentors and just brilliant doc, who's probably invented half of the testing that we have in the autoimmune world. He basically has developed antibodies to look for fungal imbalances in the gut. And part of what I'm trying to do now is see how real that is in terms of its accuracy. But one of the big problems is we don't think about it enough. We don't talk about it enough. It doesn't always show up on urine tests. It doesn't show up on blood tests. So it's one of those things where it's like this thing that is causing a big problem, but we don't even see it. And a lot of people say, well, everyone has a little bit of candida. Isn't that a big deal? Like, what is the big deal? And well, mold can't colonize the gut, right? A lot of people say that because the studies that have been done are all in adults who were perfectly healthy. And everyone presumes, well, if the adult healthy gut doesn't get colonized by molds or candida doesn't really create a problem in the adult healthy gut, therefore it can never cause a problem in anyone. And when you just think about that statement, you're like, God, that's kind of silly, isn't
Yeah.
it? Right.
Yeah.
And like you, one of the things that I didn't realize was happening to myself, and I'll expand on my patients, was exactly this. So I, for the longest time, had the uber sensitive gut. Like if I touched gluten, my digestion would fall apart, and I would experience these high levels of anxiety and all kinds of other odd things. And, like 6 to 8 years ago, I was so easily triggered by anything and everything, and like constant like mindfulness, constant breathing, 5 day, silent retreats, all of those things to just keep my nervous system calm. And it was about 2 years ago, I started really using antifungals in the kids. And I mean, some of the transformations that I was seeing were mind boggling, where, the quote unquote autistic kid that was totally disconnected from his family, aloof in the world, 2 weeks later comes and gives mom a massage and says, Mom, I love you, to the point where you're like, what? And one of the things that I experienced in myself was one, my digestion changed like in a month, and it has been more resilient than it's ever been. Not that I eat tons of gluten or dairy, but when I do, like nothing happens. And my nervous system calmed down in the most remarkable way, where it's like, I don't know if you've ever done a silent retreat, but like I walked out of a silent retreat and I was chill as can be. And after the antifungals, it was actually similar to that experience where I was so calm. Things would happen. I'd be like, that's not worth responding to. Little things would happen that before would cause me to become anxious and fear and go into these loops of overthinking. Now it's like, oh, that's not a big deal. My relationship with my wife changed. My relationship with the world changed. And all of this highlights how much inflammation these fungi and molds can cause in the gut. And I think I'm so happy we're talking about this because unfortunately, I don't see this talked about enough.
I could not agree more. Like, that's why I was so excited to have this interview today. Because for me, it's like one of my inherent passions because it literally was my cure from Crohn's. Like, that there's no question that that was integral. And I think, gosh, there's so many directions to go. One thing let's talk about, I love that you touched on diagnosis because for me, that's been this weird, mysterious thing. I actually teach at some of the groups, that we both go to. And when I'm teaching fungal diagnosis, just like you said, I have to say you have to have a high index of suspicion. So maybe let's talk about first, how do these patients, you mentioned some of it, mood, anxiety, super common. I see a massive increase or uptick in food sensitivities. Often gluten's involved because to the body that antigen can look similar to yeast, so they can kind of coexist and make one another worse. And then I see sometimes like a hungover, especially in adults, because of that acetaldehyde. So maybe just dive. Let's first talk about what would a kiddo, you're dealing with kids, I'm dealing with adults and kids. What would they look like that would make you suspect yeast? And then we can go on to talk about how do we diagnose it.
Sure. So, the first presentation that really shows up in the kids is what you touched on, where their digestion starts getting funky. So either constipation or, chronic loose bowels, foul smelling stool. But the food sensitivities is one of the first telltale signs for me that something is awry. And there are actually some studies that have really shown how aspergillus in certain fungi and molds literally program the immune system in either its ability to tolerate foods or become allergic and sensitized to foods. So when I see kids with eczema and, they have to be avoiding 15 foods because if they do eat it, something awful happens. And, they've got other issues related to their gut. And then the skin is an extension of the gut. And I think we can both agree in our world, that becomes one of the first signs that there's some kind of likely fungal imbalance in the gut.
Yeah, I would say until proven otherwise, eczema almost always has a fungal component. Would you agree? Yeah.
Absolutely. 100%. Yeah.
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 Now, interesting because as you deal with kids or newborns, what I've seen, and I love your thoughts on this, is often I don't, I'm family medicine trained, so I can see birth to death, but I typically don't see under 2 years old at this point in my practice. But when I did, I would often see the newborns having cradle cap and fungal issues, or even reflux or eczema. And guess what? The mom was colonized, right? Do you want to talk about that first, just briefly? Because I think there is a connection, obviously, with the birth canal and the colonization of a baby at birth with mom's microbiome. But maybe for those who don't understand that connection, do you want to just set us up with how that might be connected?
Yeah. So, I mean, all of these things, cradle cap, reflux, colic,
Yes.
are all signs of a immune and gastrointestinal immune disruption. And a lot of times we don't think about colic as a immunological imbalance, right? We think of, well, that's just a fussy baby, right? Babies just fuss, except there's like the fussy baby that, cries for 10, 15 minutes. You kind of shush them a little bit, they're fine. And then the kid that's screaming their head off for 3 hours a day, the parents have to drive the kid around, rock them. They're not sleeping. Kid takes 30-minute naps, wakes right on up. That's a immunological mast cell mediated inflammatory response that's dumping all kinds of histamine and other compounds into the nervous system of this kid, causing them to become totally wired. Reflux, there's reflux where babies spit up a tiny bit, and then there's reflux where mom has to avoid gluten, dairy, soy, and the kid is constantly throwing up, and they're talking about PPIs, right?
Yes. Yeah.
And the more severe forms where the gut becomes disrupted are the babies that now they're like 6 months old, 9 months old, they're still having their reflux. And rarely is it by itself. It's like this constellation in March. Baby starts off with colic, then they go on to develop reflux, then they go on to develop eczema, then they start having food sensitivities, and their digestion is never normal. And then the sad part is those are the kids that become, I believe, much more susceptible to ultimately heading into autism spectrum. Because if we ask, what is autism spectrum? What drives some of it? And obviously, it's very complex, and by no means am I saying this is the only reason, but a huge part of my practice really is controlling the inflammatory response, rebalancing the inflammatory response in these kids who present with autism spectrum. And my goodness, and some of these kids, when we're able to do that, the transformations that they have in their sensory issues, their anxiety, their OCD, their rituals, the rigidity, the stimming, the food aversions, the sleep disturbances. So this laundry list of things that we associate with autism
Yes.
is all tied to the immune system, which is all tied to the fungal imbalances, which is all tied to what's going on in the gut.
Could not agree more. And
Mhm.
I love talking about that because when we go to the root cause, these things that seem so insurmountable and epidemic in our society actually have answers, right? And we're not saying that every single kiddo with autism can be 100% healed, but you and I both see these massive transformations when we deal with the gut. So we talked about kind of how they present, and I couldn't agree more with you. And on the adult side of it, typically same thing, insomnia, anxiety, depression, and gut issues, gas, bloating, diarrhea, constipation, definitely mood disorders, sleep disorders, food sensitivities, skin is a huge one, and adult acne. So kind of like both sides of it. Let's go to diagnosis because, again, I've been teaching this for a long time, and it's always like patients, or doctors in the audience will look at me kind of like, how do I do this? And what I've been talking about is, and until we got like Dr. Bojani's test, which we can talk a little bit about today, I would say, if you get anything on the stool that's fungal, you have to be suspicious, even if it's very low. And then frequently, and again, I'd love for you to talk about this, it's in the small bowel or it's in other parts of the gut. So you very frequently will not, if I just had to guess, I'd say maybe 20%, 10% of stool profiles are positive with someone with fungal issues. And typically I'll find it on organic acids. And then I also do IgG, IgM, IgA in the blood, which there's a lot of controversy about, but in my clinical experience, I do find a correlation. What's your thoughts on those?
I think you nailed it, and I've had a lot of discussions with various people around exactly where is this fungal imbalance, and at least to my knowledge, I don't think we really know, but it definitely does not seem to be in the part of the colon that would show up in the stool, and that's one of the big limitations of the stool studies, right? We're taking a sample of what comes out of our rear end, right, which is the distal part of our colon, and we're sampling what's there. And to your point, if the imbalances are in the small bowels, in the proximal colon, in areas that would not be reflective of that, it gets completely missed. In a lot of the kids that I see, I would say the organic acid, so this urine biochemistry test that we do, 50% of the time doesn't show up.
Mhm.
And I've had kids that were living in horrible amounts of mold. First organic acid, totally normal. Second organic acid, totally normal. Third organic acid, oh my God, the fungal markers just blew up. And these are the fundamental issues with the testing we have. And
Yes.
even when you do the immune testing, at least in the little kids, what I find is, at least at the gut level, they seem to have some degree of immune suppression.
Yes.
So they have IgG, suppression of IgG. They have sometimes disruptants in IgA. So when we're looking for these immune markers like as a reflection of the imbalance, well, if the immune system is snoring and asleep and you're checking the immune system to see if there's a reaction, how are you going to find the imbalance? So it's one of these things where we think we have so advanced, sophisticated tools, but when we actually look at what they're able to detect clinically, we realize like we're kind of in the Stone Ages.
Yeah. I love that you explain that and that we agree because I have seen that. And again, because of my own history with like curing Crohn's and having it be such a big deal, I always say when I'm talking to patients and for those listening, yeast is opportunistic. we all have a tendency or proneness, we could have it. If we have a really strong, robust immune system, it's probably okay. So it's in the situation, which is why the mold yeast is so correlated, because often a child or adult in a moldy home or a situation where mold starts to compromise those immune barriers, create more histamine mast cell, which creates more permeability. The yeast starts to create this immune reaction, and then these people or kiddos have a big issue, but it may start with a little bit of immune compromise on some level, whether it's poor diet, environmental toxicity, mold exposure, and then the yeast becomes an invasive or issue. And it sounds like that's kind of what you're seeing as well.
Yeah, hallelujah. Yeah, that's exactly what I see. And, I would say with everything that we have introduced into our environment, right, the glyphosates and the poor diet and the chemicals, and at least for myself and, several colleagues that I talked to since COVID, showed up on the stage, like that just threw another monkey wrench into the works. And essentially all of these things have created this essentially super susceptibility where nowadays if kids are exposed to even what I think are moderate amounts of mold,
Yeah.
and I suspect 10 years ago these levels of mold were probably not as problematic, what I find is this super susceptibility that we're seeing in these kids. If there's any additional exposure, aka now they're living in mold,
Yeah.
they just don't have any fighting chance. And it's the saddest thing. It's heartbreaking in terms of what this is all doing to these kids.
Yeah, gosh, I love that we're similarly seeing this and hopefully able to educate our colleagues as well, because I now think of COVID as an immunocompromising infection, right? And so whether it's a few months after or 6 months after, I almost always, I'd say 80% of people, even healthy adults, see some sort of T cell dysfunction for more than a few weeks, right? It's just kind
Yeah.
of extended. So I
Yeah.
think that added to the burden since we've seen this. So one thing, it's funny because I love Dr. Vojdani's work, and I love that he's brought to light this. I wasn't anticipating us talking about this, but there's a brand new test that they've developed. I have just started using it, so I have very little experience, but that will actually test. Do you know about I think it's called biome burden?
Yeah.
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 Have you
Yeah.
started using that in clinical practice?
So I have so far, I think, four patients that I've tested, and I've tested it in some of the older kids. And so far, at least in the older kids, it's showing to be pretty accurate. And essentially, it's, our fungi plus or minus certain molds irritating the immune system, which means there's gut disruption, right? The gut has to be disrupted. The immune system is now disrupted because of these fungal imbalances. And it's proving to be a pretty handy tool.
Yeah, I'm super excited. I just started ordering it because I'm like, okay, this is because it's the same thing as we know this is an issue, and we just haven't had the exact tools to say, this is for sure. Now, what we'll go on next to is treatments, because in my experience, sometimes with just a high index of suspicion with a patient consent, we might go ahead and do antifungals and see how they go. Where do you start with that? I would love to know herbs, medications, just kind of a little bit of an outline of
Yeah.
kind of where you go with, say, someone has issues either based on a high clinical index of suspicion or organic acids or a stool test, then where do you go next to treat them?
So one of the things that I find is a lot of well-intending providers jump to antifungals without kind of understanding the bigger picture of what is going on, and that includes exposure.
Mhm.
So if a child is still living in mold and you throw antifungals at them, the the probability of a good clinical outcome is lower. Not to say it can't improve, but it's lower. And the probability of adverse issues is higher. And when we have to look at these antifungals, and when we say antifungals, I think we're both talking about, the azoles, fluconazole, itraconazole, and if you want to get fancier, something like voriconazole. These azoles are not just antifungals; they're immune modulators. And what I have seen is a child who is immunologically badly, I guess you can say, compromised or highly inflamed, and usually with that, their gastrointestinal tract and their microbiome and mycobiome, the fungal makeup of the gut, are really badly disrupted. And in those kids, it's kind of like you're walking through a landmine field, and if you just charge into that landmine field, you may set off some explosions, which are not necessarily helpful. Whereas if you can identify the source, and not all kids have active exposure. I have plenty of kids where they were exposed early on in life. Their gut got really badly disrupted, and 5 years later, they're still disrupted. But when you get rid of the exposure, that reduces the inflammatory response, right? It reduces the toxic load. It allows the system of the child to become a little bit more stable. And once that happens, then the antifungals tend to work dramatically better. So for me, the first step is, are they still living in mold? And when I assess, and I'm sure you do the same, like we don't use conventional testing, right? You don't have someone come out, they take one air sample from the entire house and say,
Right.
nope, you don't have any mold,
Great.
right?
Exactly.
So getting an ERMI, having a reputable person through someone like a like ISEAI, or somewhere where they actually go and really check. There's a company called the Dust Test.
Yeah.
That's another option.
Love it. Yeah.
But doing something that has a high sensitivity to pick up a problem.
Yeah.
And when it's like, okay, no, it's clear, child is still having issues, but they're not like completely falling apart. That is when I typically find the antifungals to be helpful. And in those cases, it's been amazing. Like the kids with restrictive eating suddenly start eating, and the kid that was only eating three foods is now trying broccoli and salmon, and their sleep issues are gone, and they're socializing better. And the kid that was, standing alone, sitting alone in school, like totally isolated. And I mean, I can only imagine like how much anxiety these poor kids have to do that, is now the kid that's, going up and wanting to interact with other kids. I've had nonverbal autistic kids that were just completely flipping out of their heads, aggressive, just highly, highly reactive. Like 3 months later, not just they're calm, but that same child who is still minimally verbal is now attempting to go up to other kids in school.
Yeah.
And they're wanting to engage and play with other kids. And all of this is just a reflection of how much this inflammation we're talking about is impacting the nervous systems of these kids, whether we call it PANS or autism or anxiety disorder or oppositional defiant disorder or OCD. We throw these labels at these kids, like those labels actually mean anything. And underneath all of these labels, all of these diagnoses that we're so quick to hand out, is all of this inflammation. And if we reconstituted our understanding to say, you know what, this poor child is becoming overwhelmed, and they have all of these sensory things and all of these eating things and all of these sleep issues, and they're constantly overwhelmed. The aggression they have is rooted in inflammation. So if we can reconstitute or redefine what these things are and say, God, is inflammation underneath all of this, which I believe it plays a huge role. And we use tools like itraconazole to reduce that inflammation, rebalance the gut. I think we can make just so much progress in how we're able to help these kids. And that's just one tool.
Yeah, what a beautiful, compassionate way you just described that, because I know just like you, I've had patients and their parents in the office, and the parents are literally in tears because there's, son or daughter maybe was aggressive or defiant, or there's these things that like the whole family's traumatized by it. And yet they know they love their child, they know they're suffering, and they haven't been able to get a doctor to look past the psychiatric stuff, right? Because sometimes they'll put them on antipsychotics or really heavy duty drugs, or give them a diagnosis of bipolar, or, like you said, oppositional defiant. There's a lot of labels that are thrown around that hurts the child and hurts the family. And yes, it gives us this description box label to talk about in medicine what's going on. But at the core, it's a family that's really disrupted by this kid's behavior. And like you, I'm sure have seen these parents that are just like beside themselves with, what do we do? And so it's exciting to go to this level, because it's the compassion of this poor child is really just suffering. And how can we relieve suffering at the end of the day? And
Yeah.
that's exactly what you're talking about. And then
Yeah.
it's not just the child's life that's changed, but the whole family, right?
Exactly.
So,
Exactly. And it they're their life has changed for the better, potentially for the rest of that child's life. And like, I think that that's one of the things that's so important about this conversation is you keep highlighting it's not we're giving a medication that the kid has to take for the rest of their life. It's we're essentially resetting their entire gut access, right? The microbiome, the entire gut immune system, the nervous system immune response. And once we do that reset and get it to hold, essentially we have created a new path, right? A new future for this child. And like that's what makes me so excited about these conversations and this work.
Yeah, I couldn't agree more. So we talked about azoles, which are pretty heavy hitters. They're amazing when they're appropriate. And I love that you said you really want to make sure they're out of exposure and all of the kind of instigating factors are at least addressed before you throw those at them. What else? I know that I really like nystatin. I would love to hear your thoughts on nystatin. And then herbals, obviously they have a place and I like to use them, but what's your thoughts on when is it appropriate to do herbals? Is that more of an early thing? And then we'll talk about mast cells too, because they come into all this. So maybe just the other options beside azoles, if someone either doesn't tolerate it, or is there a place for other treatments in the beginning? What's your thoughts on that?
So there are absolutely things to do in the beginning. But part of what I try to teach and bring out there is a child's response, whether it's positive or negative, is actually a powerful teacher, right? If a child is not responding to an azole, there's a reason for it. Are they living in mold? Is their gut so badly disrupted that they can't tolerate that medication? Are they eating certain foods that are still perpetuating their inflammatory response? So when things work, it tells us something. When it doesn't work, it tells us something. And I think a lot of providers are not yet at a point where they have this kind of understanding. And that's what I find so beautiful about these conversations to really bring this out. I love nystatin. And I've had some kids where just with nystatin, which is, it doesn't absorb into the gut, it just treats candida. But just by doing that, I've had cases of bad eczema, like severe eczema, go away in kids. Some kids, their digestive tract, just with nystatin does a reset. I've had a handful of kids where their autistic features started improving, so they were more calm, they were sleeping better, to the point where I'm like, oh my God, that's crazy.
Right, right.
When it comes to the botanicals, I still have a love affair with them. I was trained as a herbalist. I spent years learning about the plants, and I'm still enamored by what they can do. What I found is, especially in the kids with PANS and autism, is their gastrointestinal tracts usually are so hypersensitized that using botanicals, which generally have very broad antimicrobial properties, is not very well tolerated. So biocidin, all of these things, which I use regularly as first line agents when the child is just starting that, if you want to call it gut rehabilitation or detox, sometimes can trigger more problems than it solves.
Yeah.
And one of the things you touched on earlier on, which I want to highlight because it may have slipped by some of the viewers, is these kids could be reacting to anything and everything from citric acid, which is in 50% plus of the supplements, right? Probiotics, fish oils. So anything and everything can actually become a potential trigger. And half the time when families come into my practice and they've got like a laundry list of supplements they're giving the kids, I ask the parents like, okay, which ones are you absolutely sure have made a difference?
Yeah.
And usually there's like two or three, like we started this and oh my God, my kid was different. And everything else I actually take away. And I've got to tell you, like 30% of the time, just by me doing that, like they're like, oh my God, his anxiety is better. Oh my God, she's sleeping better. And it was because the supplements that they were using to try to fix something was actually creating more of a problem. So we need to start by respecting and honoring that child and what their body is trying to tell us. And really approaching this with white gloves to say, you know what, we're dealing with a very sensitive little body.
Yeah.
and we don't know what they will tolerate. We don't know what this little body will want. So let's take one step at a time, try one thing and see how it goes, and then from there move along.
Oh, I couldn't agree more. So this
Mhm.
leads into our topic of mast cell, because at the root of many of these reactions is an overactive immune system, which involves this primordial cell called the mast cell. Many of my listeners have already heard about that. But I feel like this is so crucial because essential oils and herbs are all beautiful, synergistic. I'm like you, I love plant medicine. I feel like it's crucial. However, often those are bigger triggers because there's so many more polyphenols and ingredients that they could, just like you said, it could be of citrus or it could be a salicylate or an oxalate or one of these things that they react to that's in many of these herbal preparations. So mast cells, what's your perspective on where they fit into this? Do you sometimes use natural or prescription things for mast cell activation? Does that help? Where does that fit in?
Yeah, I mean, I'm sure, like you, I see mast cells as the central piece to not all of this, but a very large part of essentially what's perpetuating the problems. I believe that in the kids who were affected by mold and dampness, the reason why they stay sick for years afterwards is a chronic cyclical loop of mast cell activation, which the histamine it releases disrupts the gut. The mast cells themselves disrupt the gut. The mast cells drive the leaky gut. You touched on it earlier. The mast cells, when they become activated, actually trigger candida to start morphing into its hyphae form. So candida becomes aggressive, right? They basically start, I guess you can say they nuke the gut.
Yeah.
And by nuking the gut, they completely mess everything up. And I mean, they're just doing their job, right? They're just trying to protect the gut and they're trying to keep us safe. But in the process, it's like the military that starts, dropping bombs on the border, and now there's no border, but they keep dropping bombs because they're trying to protect the border. And that becomes this cyclical loop of inflammation, gut dysbiosis, leaky gut, food intolerances, et cetera, et cetera, et cetera, that I've seen, go on for years after someone lived in mold. And now essentially their gut is the source of all of their inflammation and toxicity. So it's a huge deal.
Yeah, well, you framed that really well because I couldn't agree more. That's like, if I think of layers, it's always, especially in adults, like limbic activation, mast cell activation, and then the fungal and bacterial kind of those layers, just like you're describing, and out of the mold first. And so, with the mast cell activation, obviously we know antihistamines and things, but do you want to give the listeners just a clue of like maybe a few herbals you like to use and maybe some prescriptions? And again, this would
Yeah.
depend on the situation, so they could ask their doctor more about those.
Yeah. Skull cap is
Yeah.
something that usually works pretty well. I'm a huge fan of the diamine oxidase enzymes, the DAO enzymes. I find that by reducing, so these are enzymes that we all have, except when we have gut inflammation, that inflammation starts degrading these enzymes in their capacity to break down histamine. So essentially, we get histamine intolerance because our guts are disabling these enzymes. So by adding artificially or supplementing with these enzymes and reducing histamine, I find that that is sometimes really helpful. Uh, PEA, polyaminoethylonide, I think I said it correctly, I find to be really helpful for these kids. Luteolin, I know Dr. Theodorakis has talked a lot about it as a mast cell stabilizer, could be very helpful, with the exception in some kids who are uber sensitive, the polyphenols that's typically found in luteolin can actually trigger them. So on the supplement side, those are some of the things that I really like. Quercetin is something that could be helpful some of the time. I've got to tell you, maybe it's just the patients that I have started attracting and just the severity of their um, gut dysfunction, if you want to say. I have started gravitating more and more towards some of the pharmaceuticals like ketotifen, which is a mast cell stabilizer, and also degrades histamine or reduces histamine. Chromalin sometimes is really helpful. My favorite thing.
Hey guys, just a quick pause to remind you that over at drjillhealth.com, we have incredible solutions for your kids' histamine issues or mast cell activation syndrome. Two of our absolute best sellers are histamine blocker. That's, as we discussed, the DAO enzyme inhibitor. If your child's gut is becoming more sensitive to foods, it's a great way to increase the DAO enzyme, which breaks down histamine. And our literally probably bestseller on the site, drjillhealth.com, is Hist Assist. Hist Assist is a natural histamine blocker, a great way to add to the arsenal to decrease histamine or mast cell activation. So head on over to drjillhealth.com, and now we'll get back to our episode. Yes,
Um,
KPC and
uh,
BPC.
Yeah, in some of the kids, so going back to those kids that are just immunologically unstable, and I had probably 10 to 20% of the kids in my practice where I would do everything. I would try the supplements, I would try the botanicals, I would try the antifungals. They weren't living in mold, but it was as soon as you would touch their gut with anything, it would just blow up. And like I got to a point where I started looking at biologics that, the pharmaceuticals they use for colitis because I was so desperate. And I got turned on to the peptides. And my favorite combination right now is actually a combination of larazotide, which is really great for getting the gut to start healing, right? Reducing intestinal permeability, reducing gut inflammation. And then that combined with actually KPV.
Yes.
And one of the things that's been so fascinating is, especially in some of these kids with PANS or autism, when I measure their alpha MSH, so alpha MSH is this pituitary hormone that's produced that actually has some crazy anti-inflammatory properties. It regulates the microglia, it regulates the mast cells. I mean, it does so much as an anti-inflammatory compound. And when I check the alpha MSH levels in some of these kids, like it's in the tubes. Like, it's like you look at the levels, you're like, oh my God, what the heck is going on here? In some of those kids, because KPV is basically a derivative of alpha MSH, and my naive understanding of this is essentially it has some of the anti-inflammatory effects that alpha MSH has, except it's obviously not the full pituitary hormone. In some of these kids, by doing this combination within 2 or 3 weeks, it's the wildest thing. Like their entire immune system resets, their gut becomes more stable, neurologically, they're more stable, they start sleeping better, they start eating better. And then a month and a half later, when we bring in the antifungals or the botanicals or whatever else, like their tolerance for everything else is just so much better. I don't know if you've seen that with the peptides.
I'm just smiling because I so love that. So back in the days of Richie Shoemaker and Sears, which was kind of the original mold research, we've come a long way since then. And I don't agree with everything on that platform. However, there's something that is important there that I remember learning, and it was this MSH, which was frequently low or zero, almost undetectable after mold exposure. When I started diving into the research in mice models, they would induce Crohn's and colitis by depleting MSH. So there was a very clear
Wow.
correlation. They would, in lab rats, literally cause a Crohn's by blocking MSH. So it makes so much sense that you're saying that, right? I know, as I'll have to share the studies with you later, or if you're listening, I'll try to link them here in the show notes. But as I realized, like, oh, this is a huge component of intestinal permeability and the tight junctions. And then what you mentioned with the peptide, so I did not notice that or know that connection to KPV and MSH. That makes so much sense. And larazotide is this, it was studied for celiac disease because it's an anti-zonulin. So zonulin is a little trapdoor that opens and closes the cells, I think the paracellular, intracellular junctions between these
Yeah.
enterocytes that line the gut. Again, I'm saying this for the listeners because you and I know this. So this like leaky gut that happens is often incited by the inflammation from celiac or Crohn's or colitis, and zonulin is that trapdoor. So when that level is elevated, this larazotide can kind of block that thing, and really probably our best option for leaky gut, actual treatment. And it was going to go to market for celiac disease. And the drug company that had bought the rights to it decided there wasn't enough population for this to be a blockbuster. So they kind of stopped that research line, and now it's available in compounding pharmacies. But I love that backstory because those two together make so much sense. It just makes a ton of sense. I use it too. Sometimes I'll add BPC 157 to that mix as well. But that's really, and I love this information for the listeners because I think it's cutting edge. And if, like you, I'm like, okay, we can use like glutamine. That's like baseline, right? And then maybe like a bovine immune globulins or colostrum. But now I feel like the peptides are like way up here as far as the power, right, of what they
Yeah.
can do.
Yeah. Yeah. And, it's not to say that everyone needs peptides,
Right,
right? I
right.
would say that I only go to them 10% of the
Yeah,
time.
I agree.
So it's not like everyone should go running and get this. And you absolutely need to find the provider that's well trained. You don't just go buy this off the shelf. You really need to work with someone that understands it. But if we understand what our patients are telling us, right? And like part of what I love about the kids is if we can understand what they are trying to communicate to us, the kids through their bodies and their symptoms and their challenges literally tell us like, hey, this is what's going on in my little body.
Yeah.
And then with that, when we can do the testing, like checking alpha MSH, which you can do through any lab, right? You can do it through LabCorp, you can do it through
Right.
Quest, you can do it anywhere. By doing these simple tests, we can start understanding like, oh my God, like I had no idea that they had done these studies in the rats, but like by putting these pieces together and say, oh my God, this kid has all of these things, and they have a diagnosis of PANS, right? They look like autism, blah blah blah. Oh my God, look, this hormone that's a powerful immune regulator is non-existent. And this is why this child is struggling. Like this is what's so cool about all of this, right? We
It's
get to make
exactly.
such a difference.
In fact, it's just coming to mind is because I've been teaching some of this stuff because I always love to dive and I keep learning from people like you too. But there was a study, I think a China probiotic company was trying to create a probiotic that created MSH in the gut. I don't know where that ever went to, but of course it would make sense that that could be potentially beneficial if we could induce the production in the gut. And again, I don't know where that's at. I don't know if it's available. I don't think it is yet, but I saw a study a couple years ago about that. So this makes so much sense. And it's fascinating when we have these links because we've known for a long time that mold can drop MSH. And then we're like, oh, and that's a piece of the leaky gut puzzle. And like this whole thing kind of starts to come together.
Yeah.
Maybe last little bit before we wind up is probiotics. Um,
Mhm.
I would love to hear your thoughts because in my experience, we always think, and especially there's so much marketing on probiotics, this billion of this and that is the best thing. And in my experience, a lot of my patients react to probiotics the wrong ones. So I'm very careful about how I use them. And I think Dr. Mark Pimentel's latest research on SIBO, the consensus is actually until you get treated SIBO, which is a different thing that we're talking about, you don't use probiotics. So there are some evidences that suggest, what's your thought on probiotics?
I think you said it perfectly. I mean, I have been a huge fan of probiotics, forever. But to your point, I just kept seeing the children that I was, treating, and it's like, well, I'm going to use Saccharomyces boulardii because it improves, secretory IgA in the gut and reduces gut inflammation and all of these things. And I would go in there so excitedly treating, and then all of a sudden, it's like, why is my patient getting worse? Oh, it's because it's because of what I did. Uh, at this point, I use probiotics as kind of step number three.
Yeah,
So I've treated the gut.
yeah.
We've done the antifungals. We've kind of done an immune reset. The child is now in a stable place. They're doing well. Their gut is healthier. I think at that stage, probiotics are, awesome because now the children can get all of the benefits from the probiotics and all the wonderful things that they do early on. It's like pouring rocket fuel in a house fire and then wondering why your entire
Well, you're
house just
blown up.
exploded.
Oh gosh, like I said, I love talking to you. We're so aligned, and there's so few clinicians that really understand it at this level. Speaking of that, I want to just mention again, because a lot of docs and a lot of docs listen to us too, don't realize Saccharomyces boulardii, you mentioned, that's a yeast. if someone has a reaction, and especially with this new testing that Dr. Vojtani does, we maybe haven't had all the tests. There is an anti-Saccharomyces antibody you can do on LabCorp Quest. And I do that because if they have an antibody to that, they're not going to tolerate that probiotic, right?
Yeah.
And then
Yeah.
second, beta glucans, amazing immune modulators, like maybe one of the best tools we have to upregulate T cell function and natural killer cells. However, they're made from yeast cell walls. So there is a subset of population that will not do well on them. And I love mentioning that because I think the average doctor maybe doesn't know, oh, this is supposed to be good Florastor after your antibiotic. And for a kiddo who has the yeast issues, it's a big deal, right?
Yeah, yeah, and what's really spooky is I checked the Saccharomyces cerevisiae, so ASCA antibodies, which they
Yep.
usually use to diagnose Crohn's and
Yeah.
colitis. I checked them on all the kids, and what's really sad is I'd say 25-30% of my kids are positive. Do they have Crohn's? No, but they're immunologically so reactive to these yeasts that they're kind of showing up now with these Crohn's markers. And you know, to add to everything, chlorella, like when we look at how many different things, citric acid is
Yeah.
derived from yeast. So the immune system, as far as it's concerned, is seeing yeast. Chlorella, which a lot of people use to detoxify, actually has some antigenic crossover with, I think, Candida.
Yeah.
So this is why it's so important to just be careful and go slow and not just dump a million things. And, as I'm saying this, I'm thinking of myself, 8 years ago, where I would just give people a laundry list of like 16 supplements. We're going to fix everything in one time and everything's going to be better until my patients hated me and
Yeah.
I
Yeah.
made them worse.
No, I love this is such a great conversation because there's so few docs that really understand at this level. And what I see now, sadly, on social media, there's influencers, there's coaches that
Mm.
just go and take a lab test and use lab interpretation and try to give these patients advice. And without the clinical background and experience and really knowledge of this, they can do more harm than good. So if you're out there listening, just be careful, use your judgment, use your kids. But I think there's a lot of bad advice being given because people don't really understand the complexity. And for me, it's just like respecting the body's this incredible organism and respecting the patient's knowledge when they tell me, doc, I react to this. I listen. I like, okay, I don't know really why that is, but I'm just going to trust that you know your body better than I do. So, oh my gosh, this has been
Mm.
absolutely amazing. I knew it would. You are a wealth of knowledge and you're such a gift to the world in your
Oh.
practice and all that you do. And any lecture I've ever heard, it's always like, yes, speak it because you and I, have come from that same background. If people want to find out more, become a patient in your clinic, where can they find you? What's your website? Give us a little information.
So the clinic website is Holistic Kids with a W. So WHOLISTIC Kids. I'm on Instagram, also at Holistic Kids. And hopefully in the next year, we'll have a book out that really gets into some of these details because there's so many kids out there who are struggling. I mean, you see it too. There's so many kids out there who are struggling. There's so many kids who can't learn. There's so many kids who just can't socialize. So many kids are getting blamed
Yeah.
for their behaviors because they lose the ability to regulate, but because they're not autistic, everyone thinks, well, you just need to manage your emotions better, or parents need to parent better, even though the child is inflamed and toxic. And we're missing all of this. And, there's some really good information coming out. I don't think we talk enough about how dampness and mold is causing a lot of this inflammation. So, one, I'm grateful for everything you're doing and getting this information out and, to do my little part. Hopefully in the next year, we'll have that book out to really bring a lot of these things together and help a lot of families work with whoever they want to facilitate the healing for their kids.
I cannot wait. I am
Mm.
I am your biggest fan, and we will have to do another podcast when that's out. So everyone, stay tuned for that. Thank you again for being a curious, compassionate, insightful healer. It's absolutely a joy to have you on the podcast.
Well, it's my delight. And I mean, gosh, like I could just say the same for you. I so respect you and honor you as a person, as a healer, as a doctor, and, just thank you for doing this incredible work.
Hey, everybody. Hope you enjoyed that episode with Dr. K, full of great information on the microbiome, how to treat what your kiddo might be suffering from if they have mood disorders, sleep disorders, or food sensitivities. Please like and subscribe. It helps us reach more people. If you found this helpful or someone you know might be helped by this information, will you please share this episode with them and spread the word? And as always, you can find us here on YouTube, Spotify, iTunes, wherever you listen or watch podcasts. And we look forward to seeing you next week with another episode of Resiliency Radio. Until then, take care.